I'm actually
The thing is, when I moved here to study, it became kind of boring because Slovenia is such a small country.
Grandchildren, very
when
spoiled.
you think about it, and it didn't happen to you, you're like, you have to talk.
What I like in Azerbaijan is that you can always see something changing.
Yeah, they were really poor before they came back to...
So, because this is my life, this is not their life.
When you ask two people to tell you something interesting about them, they will tell you, I don't have anything special, I don't have anything to say, I'm not a really interesting person. We often think that only known people or celebrities have a life that is worth telling. But this is not true. We all live things. That's what I want to know. My name is Lison, I come from France, and I want to discover the stories behind people, and I'm sure you have a lot to say. Hello, Urška.
Hi.
You're 27, right?
Correct.
You're from Slovenia. And we had the opportunity to catch you before you went away because you're doing studies abroad.
Correct. I'm leaving to go to Montreal, Canada on Sunday.
Okay, so
just in a few days.
It was a perfect moment to catch you before you left.
Yeah.
So you actually are doing studies about cancer, actually, surviving people that survive to cancer and the consequences in terms of mental health, mostly.
Yes.
And you know this topic very well because actually you had a cancer at 22 years old.
Yes.
So I think it was interesting maybe to talk about that because, as we said before starting this interview, it's kind of a taboo. So it's a bit something that we don't talk about so much in society, even if it's something that can happen. So maybe you can explain a bit your experience about that. So to start with, what happened and how it happened, because you were doing studies at this moment.
Yeah.
Right.
Yeah. So thank you first for inviting me and having me here, and for giving me this opportunity to speak as a young cancer survivor and researcher as well. I recognize that a lot of people who have gone through that illness don't have the same opportunity. So yes, I was 22. I was studying in the United States. Already at a time, I worked in mental health. My undergraduate thesis was focusing on depression, but I also had experience with anxiety disorders, psychosis, autism. It was really a lot of clinical psychology background, but I was already focusing on oncology because a part of me was really curious to pursue medicine and seeing how people in the oncology clinic faced the existential questions and crisis was really intriguing up until the point when I started noticing a bump on my neck and feeling weaker by day and losing all the energy of a youthful person that I was. That brought me to the doctor's office, and it all snowballed and happened quite quickly. And then it felt as though overnight I became a patient at the same clinic where I would so eagerly go to study and observe patients. So that's how it all began.
And what was your first reaction? Because I don't know if I think I've read on the website for what you were writing. For which you were writing, that you didn't go to the doctor directly because you were very busy with studies and I mean, I think a lot of people, and me especially, when I see something, I don't go directly because you think, okay, it's nothing and it's going to be okay. So how long did you took to go there, and what was your first reactions?
So I do admit I was going to the doctors was on my list to do, but quite far down the list to do of priorities. So, like I said, I think as a young person, myself, I was never really sick ever in my life. So noticing changes in my body, I just thought they're gonna pass. I can sleep more. I can maybe skip a night out, and things will be all right. So as a young person, you don't necessarily think about being very sick or sick so seriously. Of course, I've done my Googling part, and once you look at the symptoms, I saw I could either have a flu or cancer. So I decided, okay, it's just a flu, it will pass. So that's one aspect that can bring to a delay in diagnosis. But I like to point out to the other aspect, which is also that once you go to the doctor, and I just recently mentioned that in one of my blogs as well, that I was first, when I was asked about my symptoms, and I just said I'm really tired and a bit stressed out, there was no suspicion from the doctor's side. They really don't assume that a young person will have cancer. It is quite a rare disease. It's augmenting, the numbers getting higher by year, but still it's not the first suspicion. So I was directed to the psychiatrist. And knowing mental health quite well, I was like, but really something else is going on.
Maybe that was also your luck, because as you said, you were doing studies. So when you do studies, you have like exams, you have a lot of things in mind. Sometimes you work at the same time. So it's not the first thing you think about. You're like, okay, I'm tired because I'm just doing a lot of, and it's the normal things. But yeah, maybe your background helped you in that, to just see that something else was maybe happening.
Yeah, I think my background was a blessing and a curse. I think sometimes knowing more can really helps you advocate for yourself. And I think it's something I'm trying to help other people with, to be able to tell doctors when they're really concerned about their health, to not just brush them off or away. On the other hand, you asked me before about my reaction. So it's a question I get asked a lot, and I think the most common reaction is a shock. It's surprising, you don't quite expect it, but I must say it took me a while to really realize what's going on. Maybe it was a bit of a denial, almost like a protective mechanism. I was a student and living far away from my family. So before I could even fully consider taking time off from school, I had to deal with a lot of bureaucratic and administrative processes. So I had to make sure that I keep my student visa, that I finish the semester, to keep my scholarship. So really everybody was very supportive, but before I could even call my parents, tell them how ill I was, it took almost a month. So I didn't have time to be too negative or too much in shock, because I had to push through. So I think that was I was running on adrenaline as well, I think, looking back.
When you went to the doctor, they directly told you that, I mean, not directly, but after exams, they directly told you it's a cancer?
The process was a little bit longer. It wasn't as straightforward. So there was the first few exams that were suspicious. Then they tell you, oh, it might be this, it might not be that. And I told them directly that I wanted to hear it. If it's bad or whatever it is, please tell me in person. I do not want to hear it over the phone. So I was quite direct. So it happened so that the nurse actually called me on a Friday afternoon. The funny thing is, once you received that call, I already knew. But I still rushed to the hospital. She sat me down and told me, okay, it's a lymphoma. But she told me I had a specific diagnosis, and then I was kind of already getting ready to take this on. Okay, how can I get better? And then once I went to the hospital to meet my oncologist, he actually told me, well, we need to do another biopsy to really confirm it might be something worse. So that kind of set me aside a little bit, because I was ready to tackle this, to start the treatments for something I thought I had, which was Hodgkin's lymphoma. And then they tell me, oh, it might not be that. It's suspicious. We need to do another surgery. So then the delay in diagnosis caused a bit of angst.
And once you had like the final diagnostic, and did they tell you like, okay, it's going to be probably cured in like 1 year, 2 years, or you didn't have any information about that?
The doctors are quite, they don't like to speak in certainties. They give you answers such as, yeah, we think it's highly curable. Sometimes they speak in percentages, and thinking back, it's actually really hard to remember. I think a part of me repressed all those memories. But I've done a lot of readings myself, and knowing the field, I never thought of myself as not being cured or without cancer. I just focused on getting the treatments done, asking them more, okay, what are the steps I need to take to get better?
I imagine that after that you had like the final diagnostic, and then you talk with your parents, saying even to you, maybe your friends, what's happening.
Yeah.
What changed in your life, even with your studies or your personal life? Or
yeah, it's like I already said, it took me quite a while to fully comprehend it. I felt as though I had to pause my life, and that led to a lot of anger. It was almost a month before I told my parents, but I was lucky enough to have support, specific family I knew. I worked with them previously, so they're based in New York. I told them first. They were the closest people physically, so I think at that point I really needed support that was able to be present around me. Just physical connection, human touch, people who really wish you well. And telling friends was sometimes actually challenging, which I think is also resonates among other peers that have lived with this illness. When a person gets sick with cancer of any age, they themselves have to face this mortality, the finitude.
Yeah.
And I think that is the source of all the anxiety. But also people around them and young people, when a person gets sick, they are kind of forced to consider that, perhaps the things that they don't want to think about. So sometimes it happens that people disappear. Friends you thought are really close to you and you want in your life don't know how to react, and they think it's best to take a step back. So that is sometimes hard. In a case, I remember friends of mine burst into tears, and it was hard for me because I wasn't allowing myself to cry. I couldn't allow myself to cry. I felt that I couldn't, because I had to take care of myself. So if I'm crying, I'm not dealing with it effectively. Or that's what I thought at that time. So I really had to push through. And then it was hard because I almost felt like I had to take care of my friends now.
Okay, so it's another responsibility to also take care of the family or the friends.
I did feel that sometimes I had to be strong for others, and it's really hard. It's a bit burdensome when you feel that. And I recognize that part of that is perhaps putting that burden on myself, but part of it also comes from the outside, I think.
It makes me think that I have one friend, so it's not the same sickness, but she told me something similar. She has like, I don't know the name in English, like fibromyalgia.
Yeah.
So, and she told me that she lost a lot of friends after that. When she said that I have this, then people just stop giving news and disappeared a bit. Because as you say, you're scared, I think, and you don't know how to react, because also you don't know the sickness, you don't know how you can be useful, and so on. Do you have maybe some advices for like people around the person sick?
Yeah, I think disappearing is not the best thing you can do. I understand it's hard to know what to say, and there isn't a recipe, because people were all different, and some people might just need hugs and other people might just need swearing. So recognizing that, but just being present, offer a hand and listen to the person when they're going through tough times. I think that's invaluable. But just like some people completely disappear, other people come into your life, and I think it balances out. In terms of advice, one thing I like to emphasize is that a lot of people say, just tell me what you need and I'll do it. But if you think about it, it's really hard. That's a lot. I'm not just going to call you at 3 a.m. to bring me some tea. That's a lot to ask for, even from a very close friend. So offer me something concrete. It's okay if you don't feel up to going to the hospital with me, but then tell me, hey, if you need, or if you want to go to take a walk on Sunday, I'll be there. So that's a concrete thing that you can do. And then that person can tell you if they're up for it. Don't offer more than what you can do for that person. It's okay, no matter how little thing you can offer, but just be concrete. Makes it easier on the patient.
I also had this feeling that you become, I don't know if it was also your feeling, but the sick person before being Urška or before being someone else. It's like, because of that, it's like the first thing that come in mind is the sickness. I don't know if you had this feeling.
Yeah, I think sometimes it can happen, especially if you're open about it, then people start, or maybe sometimes if you're not open about it, people see you as that person. I felt, cancer on 2 legs, but it's really not that. And that's the important part for anybody who's sick with any illness, that they try to maintain their identity separate, or because illness inevitably becomes part of who you are. It shapes you. It's profound experience that can direct you, or in some way it does interfere with your life and perhaps career goals and anything. I think it's important to allow yourself to still be a young person and do the things that you would otherwise as well. Perhaps you're limited in certain ways, but find other ways to express your youth. Particularly in young people, I find that we're found in this phase of transitions, either graduating from school or trying to become ever more independent, starting a new job, and then you get sick and you kind of have to pause that. Find other ways to express your youth and energy, and don't be afraid to do stupid things, because that's part of growing up. And that's something I like to write about, that yes, you kind of have to become a parent to yourself and have to take care of yourself and think about not drinking too much, because you can get super ill and risk your life, but try to live as normal as you would.
About that, like, do you have some examples of things that you were doing to allow yourself to still be, as you said, in this youth moment of your life?
I would try and go on dates. Only happened once. It wasn't a great experience. It did make me realize that I am quite sick. I would try and I would still go on walks. I was upset I couldn't run, but I said, okay, I can still walk. That's fine. Get the fresh air. Read more books that I wouldn't have time for otherwise. Watch movies. See my friends. And
I noticed also, to go back in the advice part, on one of the articles that you wrote, that you were saying, maybe to explain also to your friend, that it's not because you don't want to go out or you don't want to, but for now you just need some rest, or you like to have this, not education role, but also to say it's not against you, it's just because for now I need to.
People who are around that person who's sick, they just have to be generous with them. And it's not always easy. I was always used to saying yes to people. Let's go for a drink. Let's go for a coffee. And then during the treatment, you're often limited in the amount of time you have when you're feeling even close to being a human sometimes. So that those few hours that you have that are functional, you kind of reconsider how you want to spend them. And if you say no to a friend, it's not personal. It's just that person just needs time.
In what you say, it's really this trying to keep a balance between be aware that you are sick, it's a fact, it's going to change your life, and say it to people, but also keeping your identity and your the thing that you like to do.
Exactly.
Not completely being in denial.
Exactly. Finding that balance.
I've seen, like, to continue with that, but you did like an important, I think, meeting once with one friend of your selling teacher, I think, Kevin. Yeah. That was also like a cancer surviving, but he was older than you. Can you explain a bit what was this meeting?
That was, so one thing I really sought out when I was sick was cancer peers. I felt as though I had my friends who were supportive, but there were things they couldn't understand. And I just wanted a person who has gone through something similar, vaguely similar. I know everybody's experience is completely different, but there's something that at an intimate level that connects you to the other person. And I never had that. So Kevin, I got in touch with him through my sailing coach at Yale. And we spoke, and I loved his blunt and honesty, just saying, okay, cut the crap. Tell me, you're super positive, but what's going through your mind? You're super sick. You should acknowledge that. And that night really made me think that I should do things for myself. We had a social gathering afterwards that I just said, no, thank you. And I went home and allowed myself to feel like I describe it. And I was super angry for the first time. It wasn't fair what was happening to me. And I'm allowed to feel that way. I'm allowed to feel betrayed by my body. No one can take that away from me. My feelings are mine. It's my experience. And that was quite empowering, I found. Yeah. And in fact, this connection with the peers, just recently I was in Budapest at a meeting by Youth Cancer Europe. And it was the first time I was in the same room with 70 plus people who had a lived experience of cancer. And I think it was so powerful and inspiring to see other people who have gone through something similar. We just connected instantly on some level. And I found it invaluable, really.
And do you think like the fact that at first you were trying to stay very positive and so on, is it because also of this taboo of the sickness that, we have also this image of we have to be strong, we have to go on, to move on, especially in this moment of the society. I don't think it makes sense, but we are really encouraged to that. And not so much, I think that's a bit toxic sometimes, even when I heard people, when you're sick or so on, and I think it's not bad intention, but sometimes people are just like, hey, let's stay positive and let's move on. Okay, but allowed me also to be sad because it's also a part of life. Yeah,
I love that you bring that up. In fact, looking retrospectively, it's a bit hard to not be biased because where I stand now, I have a lot more knowledge than I did back then about the topic. Perhaps a part of me was trying to be positive, and it's true, the way the society even talks about cancer. And I think Slovenia a little more than perhaps the UK and England. The taboo around it is bigger, and cancer means a fatal disease or death. The association is quite strong. So I think I did put this mask on sometimes, being strong for the parents, for the family, because I knew they struggled with it as well. And it is difficult. It takes a bit of a toll, especially in mental health, and just feeling positive all the time. It's inhumane. It's impossible. No one can. So yes, I think it's important to be optimistic. But like I said, reserve all right to yourself to feel angry and swear, because in that moment when you're feeling that's the best you're doing. You're coping in the best way you can. And if it's crying, it's crying, and that's totally okay. Yeah.
So that's also something that people around you have to understand, that not just pushing and say, stay positive, but also allow the low moments.
Low moments and crying is also part of the fight against the disease. So people should really take that into account.
You wrote once that this experience of the sickness made you become an adult quicker. Yeah. What does it taught you?
The illness has really, I was forced into taking care of myself for a long time when I just didn't want to be too responsible. I call it pseudo maturity, because I was mature enough to go to the appointments and follow through with the treatment. But there were days when I really just acted like a child. I think it was the complete opposite of that maturity, when I just wouldn't want to get out of bed. And yeah, especially around parents, I think it's a bit of a regression. Just to clarify, I started my treatments in the States where I was at school, but eventually transferred home to Slovenia because I was living alone and it became too hard. So once I moved into my old room, childhood room, then I, in some ways, regressed a little bit, and my mother would bring me tea, and I had a few fists, and I acted like a child. So I think it's the opposite of that constant taking care. And I need to worry who I'm going to see, and if they cough into me, I can get an infection because my immune system is suppressed. And then just being outraged, throw a tantrum.
It's like a lot of responsibilities.
Yeah.
At a really young age, actually.
Yeah.
I think even when you're older and you're not prepared to face so much things, is going to change a lot your life.
Yeah. Cancer is difficult at any age, but young people have different needs, different worries, perhaps, than older people. Yeah,
for sure. And I have a question about that, because when we talk about sickness, we talk, and I think you know really well this topic, but we talk a lot about the physical part, like treating it and so on. But maybe it's like a too personal question, but were you followed by a therapist at this moment?
Yeah, so in the States, the care was very holistic. I was offered psychological supervision, so to say, from the very beginning. And I definitely took advantage of that. I was seeing a psychologist once a week just to talk to someone or pose any questions, or just let it all out. I think having psychological support is very important. The medicine as we know it today, the advancements in technology and digital, they can become very burdensome on the patient and treat the patient as the medicine is very materialistic in a philosophical sense. We treat cancer because it stems from a cell that has gone a little cuckoo, and we target it with treatment, chemotherapy, and it kills it, and then you're fine. But throughout that whole process, there's a person behind these cells. It's a human is a lot more than just a body and a physical body. Or at least I'm still trying to understand where is this consciousness coming from, right? So that's the whole neuroscience there. We don't have answers. But yes, psychological aspects are important, and throughout history we were fighting the disease, trying to survive, but now we know people can survive, can get treated for cancer. So what happens after? How can we help these people who have gone through such an experience that made them face their mortality? How can they reintegrate normally? How can they deal with the consequences of illness if they've lost a leg, or if they're left with scars or permanent infertility? These are all very important aspects that can have a profound impact on the quality of life. So there comes the psychological part, learning how to live life with illness and after.
That's actually the topic of your PhD, more or less,
Yeah, so like I said, I was already studying in the oncological field in psychology and mental health. So I think after my experience, then I came to bridge this. And right now I look into the mechanisms of adaptation to life after cancer in young people primarily. So looking at what are the factors, be it risk factors or protective factors, that can have an impact. And then based on that, we hope to start developing more tailored approach to care, so that once we know what factors impact the adaptation, then we can really provide the right services. We're not there yet.
Okay, and it took you like 6 months to be cured?
It's really hard to say the precise timing. It took 6 months of chemotherapy.
Okay.
And beyond that, the cure, I think it took a lot longer for my body to really fully recover. The treatment was intense for 6 months, and then the full recovery took close to 2 years, I would say. Yeah.
And right now, how do you feel?
I feel fine. There's days when I feel normal, and I think that's the hard part, when I have days when I feel low in energy or get sick. I often think, is it just that I just got a virus, or is it something more? So then I try and tell myself, well, anybody can get sick. But sometimes I feel like, I get sick so quickly. My immune system's never really bounced back entirely. So it's hard to really know.
Of course. And about your PhD, so you're gonna finish, do you have like a deadline about that?
I have a hard deadline, but it's not coming up for another year and a half or so. So I have some more time. I'm about halfway through right now.
Okay.
Yeah.
Do you already have some conclusion that you did? Or?
So last year we published, actually this year we published a systematic review, and we were just looking at mental health outcomes in adolescent cancer survivors up to the age of 23. We do see that there's a smaller subset. A lot of people do very well. They adapt quite well. But there's a subset of them that experience higher levels of anxiety, perhaps even depression or PTSD symptoms. And these are the people I hope to work with, that to really understand those who aren't doing well. How can we help those? But I just recently, it's currently in press, an article where I discussed the difficulties and the methodological issues in the research in this particular population, because the age gap I study is between around 15 to 39, which is the broader definition of adolescents and young adults, based on the US definition. So the challenges there are, up until now, these people have either been grouped with younger patients, so pediatric care, or with older patients. So the data we have for them, it's really mixed together and hard to disentangle. There is lack of clinical trials specific for that age. The challenges they face are distinct. Like I said, they're found in these transitions of life that can be quite prominent. Yeah, and the current work in mental health outcomes, it's really the questionnaires with which we measure these constructs are not adapted to cancer populations. We know perhaps one of the symptoms of depression is fatigue, but fatigue can be caused by illness itself or treatment. So how can we make sure that we really are measuring the symptoms of depression and not cancer?
Yeah.
So we need to really adapt and see what other ways we can use to assess the mental component and mental health in cancer patients. And another aspect that I find slightly problematic is that we often hear about triumphant stories. We hear about people who beat it, who did really well, and they're super positive. Again, going back to that positivity, it's never as straightforward. We talk about resilience as if it's one way to be, and it's really a dynamic process. It's ups and downs all the time, and having a down doesn't mean that you're not doing well. So I try to emphasize that in my work and try to encourage research in the population, particularly to hear from those who are perhaps struggling, because I don't think they're represented in our work. Like I said, a lot of people do very well, but we're trying to understand those who aren't. Please talk to us. So yeah, in my work, I'm trying to make the research more representative of those populations. Because from the meetings I've been going to, I hear one side of the story from researchers that are really saying, okay, we found very low depression rates and anxiety. We're happy with it. But then when I hear stories of young patients and survivors, I hold my head, because it's such a big gap between what they tell me and what researchers thinks. So we need to bridge that.
Yeah, I think it's a very important work. Also because, as we said before, I think I heard that many times, that okay, he survived to cancer, or she survived to cancer because she was very mentally strong. Like it was okay. And if you don't, it's it was because you were not mentally strong enough, which is really making the person feeling even more guilty. And actually it's like something so hard that, of course, you have, as you say, up and down. But today, like, does this experience change something about the way even you live your daily life? Something that changed in the way you were?
I think sometimes my humor has gotten darker, and I like to think that certain aspects I used to worry about, or things I used to worry about, I just no longer do. Or I try to put things in perspective when I get lost and consumed into this everyday hustle of life. I try to take a step back and say, wait, is that really that important that I need to do it right now? Or can you do it tomorrow and just take some rest? So I try to consider that there's more to life than just work and this constant stress and deadlines. Yeah.
I'm not like a big fan of quote, and I think I've read in one of your articles that you were not really fan of it neither. Like, you know, when this really positive quote that sometimes you read, but actually makes sense in some situation, especially when it's hard situation. So that's just something that you wrote in your in one of your articles. So you wrote, we have finite numbers of heartbeats. Finite numbers of heartbeats, sorry. So it would be sad to waste them stressing out about things that won't matter a week, a month, or even a year from now.
Yeah.
And I think it's quite, it's quite true. And do you have something else that you want to share? Maybe some advices for people that can be sick, actually? Or
I think people who are sick, they just... I want them to recover quickly. More than telling them what to do, I want to tell the rest of society to really offer a hand, listen. If you're struggling that day and your friend is sick, remember that they're also struggling. And yeah, cancer is no longer a taboo topic. Don't be afraid to speak about it.
Thank you very much for that, because as I told you before, that's something that stressed me a lot too, like a lot of people. I'm very, like, I had this image of you have a cancer, so you're gonna die, basically. And the fact that you give this experience of, actually you can survive and people can survive, and it's not easy, but as another sickness, you can actually go through it. So I think it's a really important message to share.
Yeah.
So thank you very much about that.
Thank you. Thank you for having me.
And good luck for your PhD.
Thank you.
Thank you again.
Thank you for listening to this podcast. If you want to participate, to talk about a specific topic or something that happened to you, you can send me a private message on Center Mladi Koper Facebook page. I will be really happy to meet you. See you soon for a new story.